commonly look at on cases such as some of the patients that have pancreatitis or pseudocysts, and we'll talk about what pseudocysts are here in just a moment. So basically what we're doing is I made this drawing here, and it's very elementary, so bear with me. I'm not an artist, but I did the best I could. So anyways, so here's kind of a drawing that I have of the upper GI procedure and what we're doing. And I'll talk about kind of what all's going on here, because some of these things might seem kind of weird. So here's our scope, and it's coming down through the esophagus, right? And then it's going down through this sphincter here. Now this sphincter allows the food to go into the stomach, and then it'll come up into the top part of the stomach, which is called the fundus. And then the body of the stomach, and then the rest of the stomach, and it churns the food, okay? Because the food's coming down as a bolus, right? And as it, once we chew it up, we're swallowing it, it comes down as a bolus, and it gets churned throughout the acid of the stomach. And as it breaks down the food even more, then it goes ahead and it enters into the duodenum, and it gets processed into the duodenum, and then goes through and does the rest of what the intestines have to do for it. So that way we can get the energy from the food that we need and things of that nature. So what I drew here is our scope. So it's important to kind of know these things about like the anatomy of the stomach, so we can actually visualize what we're looking for and where we're going. Now on the end of the scope here, I put where the actual ultrasound is, and it's projecting these ultrasound waves, right, that are sending these sounds back and forth, so we can kind of see if anything that is abnormal. As we're on this specific patient, we're looking at the pancreas. So I didn't do a very good job. I wish I could have done better, but with these dry erase markers, it's kind of hard. You can see here, I was trying to, this orange area, let me go through here real quick. This orange area is basically where the pancreas is. And then I tried to make this a little bit more orange, kind of as far as, I guess, a darker orange, so to say. It didn't really show up very well. But that is where we're looking at some fluid buildup. Now, this fluid buildup happens because this patient has pancreatitis, and after being diagnosed with pancreatitis, they end up having pseudocysts. Now, these pseudocysts, sometimes they show up in our scans, such as like a CT scan, and we can go ahead and we can go forward with the EUS procedure and get a better look directly into what all is going on, looking into past the stomach, actually right into the pancreas. So rather than doing like the general type of an ultrasound where we're staying on the outside of the skin, we start to look through the fat and things that are built up in between there and the pancreas and the stomach. And so this is more of a direct route, and so it gives us a better view of what we're looking for. So right here, we're looking for this fluid buildup, which is causing these pseudocysts. So we look at this. Now, I made a little tiny, like, black spot, right? Kind of like a line right here. That's representing a needle that we're going to use for aspiration. Okay, this is just a flow chart from the American College of Radiology. That's just kind of showing us about pancreatic cysts and when the appropriate time is to do the aspiration. So we're looking at the right side of the chart, not so much the middle of the chart, to let us know when the appropriate time to do that aspiration is. Okay, in this picture, we're looking at where the scope is being placed, and we can see where we're using the fine needle aspiration in order to conduct a biopsy on this patient. So that way we can go ahead and get it sent off to pathology for further review. Okay, we're getting ready to go ahead and do our endoscopic ultrasound. And you'll notice the physician is going to enter the scope in. We notice that there's a cyst already there, probably from a prior scan. So he goes into the stomach. He's going to go past the stomach and start looking at the pancreas. He's going to go around. He's in the duodenum right now. And you'll see his camera view, and then you'll see his ultrasound view as well. So we know right there is where we have some issues. Now the physician is going to slowly pull the scope back out of that area temporarily. And the reason why is he wants to look at the whole entire pancreas to make sure he did not miss anything. So nothing missed. So he's going to go back to the cyst. He's going to enter the needle in for the aspiration. He's going to extract the cyst and the buildup. And it will be sent off to pathology. So this is just a picture here of what we did. Of course, we went into the stomach with the EUS scope, and you can see we are visualizing the pancreas specifically, and notice that there is a pseudocyst there, and we went ahead and extracted the fluid from the pseudocyst. And if you notice, there's the gallbladder off to the left. Right above that is where the liver would be, and I'm talking about to the left of the screen. It would be to the right of the patient. But that's basically it, and how we were able to do everything from a picture standpoint.